All right, thank you. So I'm going to speak about a few different things. I want to kind of try to make it whole at the end. So it's really important that we get at the end of my talk. So I might speed a little bit, but otherwise we will just have strands of things here and there. So the first thing I just want, if you can advance the slides, I just want to say that the program that I lead, the Initiative of Islamic Medicine, thinks of itself at this intersection between the seminary and between the academy, where we are along the axis of Islam, trying to help people who think about Islam as a lived tradition, the minister to the Muslims, and those who study Islam from an academic perspective to come together for greater understanding about what Islam means to them. Similarly, we're at the intersection between the Muslim community and the healthcare system, where for the Muslims, their Islamic identity, their values might inform the way they think about health, what they do to get better and healthy, as you saw in that video, but also the healthcare system that's trying to accommodate them culturally in the delivery of healthcare. So that's where we reside. It's a product of translation, and so we have to bring a lot of people together. And so I'm very glad to be part of this conversation. We're bringing people together. So the next slide, go ahead, forward, next slide. The work I'm presenting today is one where we've had physicians, religious leaders from the seminary, as well as academics come together over many years. So it's not the work of myself, but of all of us together. So I'm presenting on their behalf as well. You can advance again. So a little background. Go ahead, advance. So the ethical challenges at end of life are we all face these, right? And one of the challenges, as has been described over the last hour plus, is that the borders between life and death are made fuzzy by our increasing technological capabilities, right? So we can intervene, we can withhold life support, we can withdraw life support, we can sedate people to bring an end to their life. We can do all these things, and the question is, should we? And if we think that we should, or we have a moral obligation to do so, then the question becomes, what is the best way to act? How do you beautify that action and make it one that's consistent with your values? On the other hand, this is a physician's perspective, and we have the family perspective, where there's a lack of clarity about the ethical responsibility of those involved in medical decision-making. What is the model of shared decision-making between the physician and the family or the patient themselves? Who are the surrogate decision-makers, and whose authority should we listen to? Do families and patients have the health literacy to engage in these conversations? In many cases, I'd argue they don't. And then the question becomes, is the healthcare team trustworthy? We talked about, and you mentioned, I think, the idea that the prioritization of life, of having inestimable value, came out of a horrible situation with Jews being killed, right, in the Holocaust. And so this prioritization became of life at all costs, potentially. Similarly, there are many communities that we know that don't trust the healthcare system, right? African American communities that don't trust the healthcare system. So when they make decisions about what they should do, they're always trying to prioritize life because they don't trust what you're telling them. So this is something real and palpable that we must think about when we make decisions. Next slide. So in terms of the Muslim community, my program, we had a national survey of Muslim physicians that was finished in 2014. And in this survey, we asked various questions about end-of-life care to Muslim docs practicing today. We asked about withdrawal versus withholding, and you see here that 79% found it more ethically problematic to withdraw than to withhold life support. In the secular literature, we always equate these two. And you've heard today, from the Jewish perspective and other perspectives, that's not the case. Here, from Muslim physicians, they feel there's some difference between these two acts. What's interesting also, 18% disagreed about the compliance with the competent patient's request to withdraw life support. So if we're talking about giving people medication to end their life, here the question was, can we even allow them to withdraw life support? So there was 1 out of 5 physicians had this challenge as well. So it tells you there's something going on in end-of-life care that physicians, Muslim physicians in particular, are struggling with. As far as brain death, you see here nearly half of the sample did not equate brain death to cardiac death. So the Muslim community of docs is challenged with this realm of care. Moving on. So let me talk about Islamic bioethics. That's what I'm going to be spending most of my talk about. So what is Islamic bioethics? You should know it's a new field of academic inquiry with many different stakeholders. Both the Islamic aspect and the bioethics aspect are contentious, right? So there's lack of clarity about what is Islamic, what content qualifies as Islamic, what are the disciplinary parameters and the research methods of this growing field. Similarly, with the bioethics portion, the questions about the scope and nature of bioethics. Who are the audiences, right? We talk about public health ethics, we talk about clinical medical ethics. There are different levels and strata in which we engage. And then is it a multi or interdisciplinary field? By that I mean multidisciplinary field would be one where different experts come together and they engage from their different expertise on an area, on a topic. An interdisciplinary field means that it's in between two fields. So you're required to have content expertise in two fields to engage in this venture. So moving on, the way I think about it is that Islamic bioethics would be somewhere here, where the inputs from the Muslim tradition would be one is from Islamic law, from our moral theology, and from our traditions of ethics, and that those are the inputs from the tradition that interact with discursive partners in other fields, such as clinical practice, social science, medical sciences, policy, and whatnot. So all these come together and engage, and then you can produce an Islamic bioethic about X, Y, Z. Moving on. So because ethics, because for me, I think of law as a source of ethical guidance, I'm going to talk a little bit today in what follows when I make arguments using this sort of rubric, right? That Islamic ethical legal deliberation starts with looking at the usul, right? So looking at the textual sources of Islam. There are various formal sources, you don't need to know them, but you start with usul, so an Usulian paradigm. Then you think about the objectives of Islamic law, which are derived from these scriptural source texts, and then you apply legal maxims, right? Qawaid, to help get you to the right decision, or at least make an argument about a decision. So that's how I'm going to proceed with the arguments that come, right? We're going to start with texts, and talk potentially a little bit about concepts that have to do with the objectives of law. I'm not going to spend too much time about legal maxims, but they might come up. All right, moving on. So traditionally, this is what happens in Islamic bioethics. You have a physician, they go about thinking about some treatment or some modality, and then they go proceed and ask a scholar of Islamic law, keep on going, about this matter. That scholar then ruminates over the scriptural sources of Islam, the Quran and Sunnah, as I mentioned, the objectives and the maxims. Then he deduces whether that action is along this spectrum, from obligatory to forbidden, and he issues a juridical ruling, a fatwa. This happens in one-on-one, but it can also happen in communities where you have a lot of doctors, keep on advancing, a lot of doctors come together, a lot of scholars come together to provide opinions. All right. So I think that we should acknowledge both that one individual at a patient and religious leader level can make a fatwa, but also that there are juridical bodies that come about and think about these things. So now to the idea of Islamic bioethics in the context of end-of-life care. I want to make an argument about when we must seek healthcare from an Islamic perspective. So Sheikh Fazaga spoke about this. I'm going to embellish upon that. We're going to talk about when we can withhold or withdraw life-sustaining treatment. So that's the second piece. So when must you go? When can you stop? And then we're going to talk about a theologically robust quality of life marker that's in between. That should be our sort of end goal when we think about healthcare. All of this is in this paper that you can find. It's an A-job, and I will send the reference if you want, but it was this year, came out earlier this year. So moving on, let's talk about the scriptural source text. So I said I'm going to start with Usul. So one of the verses in the Quran talks about Abraham, quotes Abraham making a prayer, and he says, when I am ill, it is he who cures me. وَفَإِذَا أَمْرَضْتُ فَهُوَ يَشْفِينِ. And so this gives you a sense of that the active cure, the active healing is one that God, right, allows to happen or performs. And you have prophetic statements, these are some examples of that talk about medical care. One of them is often quoted as a command in the imperative form, seek medical treatment, for except senility. God has not created an illness except that he has also created a cure. At the same time, however, the Prophet, another set of narrations from the Prophet talk about the people who enter paradise without any judgment. So amongst these groups is a group that they have never allowed themselves to be treated by cauterization. Rather, they have put their trust in God alone, and they're mutawakkilin. So the idea here is that at that time, cauterization was a treatment, a medical treatment for various maladies. But he speaks about those who enter paradise without any judgment are those who have entrusted their lives to God alone. So this is where the tension resides, right? You have God, who's seen as the one who brings about cure. You have an idea of you should seek medical treatment, right? Because God has provided the cure and the illness. But also, those who do not pursue treatment have a great reward. All right, so those are the poles between the juristic discussion. So the next slide, please. So I'm going to speak from the perspective of the four Sunni schools. I'm going to just give you the legal rulings, and then we're going to talk a little about the rationale behind it. So in the Hanafi school of Islamic law, which is the largest of Sunni Islamic law, it's the largest school, most adherents, one of the oldest schools of Islamic law, the default ruling about the obligation to seek medical treatment is that it's permissible, but not an obligation. That it resides in the realm of permissibility, but one who does not seek medical treatment does not sin, therefore it's not prohibited. The rationale is that there is no certainty that medical treatment will cure, and it's possible that the person who is sick will become well without treatment. right? The idea that God is the one who cures. Yet they say, an extension of that ruling, if there is certainty, right, by the patient themselves, that their harm will be removed of the disease or illness, then they're obliged to seek. But they have to have the level of certainty, right? And this is a topic I'll talk about in a second. So you have to be very certain that this treatment will remove the harm. So diseases can have many different harms upon you, right? So for example, I have a headache. I take Tylenol. I know that Tylenol will remove my headache, right? And that's a harm. So they talk about rulings. For example, a leader of prayer, an imam, has to read the Quran in Ramadan, right? When we pray all night. He has a headache and that's going to affect his ability to read the Quran. Is it obliged upon him to take that Tylenol? And scholars say yes, because Tylenol will reduce that headache, will allow him to read the Quran, which will be a benefit to the people after. So so you have the general ruling, but then you have the exceptions or the fatwa that come through about particular instances and circumstances. But the point here is that the general ruling is that's permissible, except for where there is certainty of the removal of harm. You'll see the next school, the Maliki school, they have a very similar judgment, right, where the default ruling is permissibility. But they do say that there is sin upon the individual who dies due to not seeking treatments that are known with certainty, not by the patient, but by the physician, that they have curative power. So the difference between the Hanafi and the Maliki is the Hanafis say that's the individual has to make a decision. They have to be certain about a treatment. In the Maliki school, they talk about the physician being certain about that treatment. Moving on, next slide. So the Shafi school, they are the school that talks about medical treatment, seeking medical treatment as a recommended act. So you've gone from permissible, no sin, no reward, to now a recommendation. If you do it, you get reward. If you don't do it, there's no penalty. The rationale for them is that seeking treatment coheres with the Prophet's teachings and word and deed. He said, seek medical treatment. It was an imperative form of the command. So you're following his command. And from his biography, we know he sought medical treatment. So now you're performing what he said to do and adopting his mannerisms of seeking medical treatment. That's why it must be recommended, not just permissible. They talk about the idea that it's not obligatory, so it doesn't get to the realm of if you do not seek medical treatment, you sin, because there's a lack of certainty, again, in it being effective. Right? So medical treatment is not certainly going to cure you or remove that harm. However, when certainty arises, it becomes obligatory. Right? So the same rationale as the other schools is here. So in their case, they allow both certainty in the physician or the patient themselves about a medical treatment. They don't have to seek a medical opinion. It could be just the patient themselves feel their certainty about something. All right, so now the school that stands in distinction to all these schools is the Hamli school. And for them, it's also seeking medical treatment is permissible, but they clearly state, and this opinion of Imam Muhammad himself, that not utilizing medical treatment is more meritorious. That's the rewarded condition. The reason being that the other narration told you about, those who forego cauterization are amongst those who do not have any judgment before they enter paradise. So how do you resolve that? And they said that that's the highest level. That's where we should all go to. We should be of those who are relying on God. If God wants to cure, alhamdulillah. If he doesn't, alhamdulillah. But we trust in God completely. Right? So that's how they view this. Okay, moving on. So as I mentioned, the points of deliberation are the reconciliation of the prophetic directive, with reward for abstaining. There's a directive to get, but there's also a reward for abstaining. The certainty about cure. God is ultimately bringing about cure. Medical knowledge is probabilistic. This is classical opinions from the 12th, 13th century. At that time and now, we still know it's probabilistic. So the question was, can probabilistic knowledge lead to a moral obligation or not? And some schools allowed that for some reasons, others did not about medicine. And the clinical context, right? So it's sinful, according to some schools, if one dies due to abstaining from medical treatment that is known with certainty. Right? So if you take all of these together, these are the classical rulings, you have this possible, and I'm going to say forced zone of consensus, that treatments that certainly save life are obligatory to seek. But that's it. Right? So you have to have a high level of epidemiologic data to say something is certainly going to treat something. And when you have that, and that's going to save your life, forestall death, then that's obliged to seek, otherwise not. Right? And that's very important. So we treat medicine with, at hand's length. So now you say these are all classical opinions. Let's move to a more modern juridical council. This is the one that Sheikh Yasser quoted, I believe. Back, there you go. So they talk about it's obligatory to seek medical treatment when neglect might result in death. It's life-saving. And they talk about loss of organ or disability, and then this contagion bit. Right? So they took all these rulings and said, well, in the modern day, we have to allow for contagion. Also, it's not sufficient just that you're going to save your life, but if you are going to be severely disabled, that's also a problem. Right? But that's their extension of classical opinions. An Islamic scholar does not need to go to their fatwa. He could just say that the rulings on the books of classical scholars, that's the weight of the school. That's the weight of the tradition, right? Not one opinion. But this is an ethically plural system, so you can choose whatever you like. So moving on. So we talked about when are Muslims obliged to seek medical treatment. The answer was when treatment is life-saving and that treatment has there's certainty about that treatment. Then you can map that onto when are Muslims, sort of physicians, obliged to provide medical treatment the same way. There's a reciprocal duty. If they are obliged to seek in certain instances, if you have treatments that meet those thresholds, you're obliged to give them. So the construct here, moving on, is life-saving. So let's talk a little bit about what's life-saving. So I said the second piece that you must bear with me is about withdrawing and withholding life support. So you can advance the slide. So we talked about when you must seek. The question is, when can you forego? So when is it Islamically permissible to withdraw or withhold life support? And what I have listed here are various juridical councils that came together talking about when it's permissible to withhold or withdraw. And I'm going to advance these slides to give you the summary at the end. No, move back, please. Okay. So often what they talk about is idea of uselessness or lack of utility of the medical treatment. And then when they talk about withdrawing, they talk about these states of brain death often, right? So that's the idea. When you're at the state of brain death, you can withdraw life support. When you want to withhold, you withhold support that's not going to be of benefit to the person. So thinking about brain death, moving on. Brain death is not death legally according to some scholars, right? So you have two different juridical councils which had physicians come together and testify about brain death in the late 80s, early 90s. And these are the two most often quoted juridical verdicts about brain death. One organization, the one group, the Organization of Islamic Conferences, their fiqh academy said that brain death is death, it's legal death in Islam, and they talk about brain death as all vital functions of the brain cease irreversibly and the brain has started to degenerate. The Islamic Organization for Medical Sciences, on the other hand, their juridical council, they came together and they think of brain death as not legal death in Islam, but unstable life, meaning this could be the ghosts here, right? So unstable life, that it's a hayat ghayr mustaqirra. It's not stable in the individual, but it's a dying state. And they say that if a person has reached brainstem death, some of the rulings of this unstable life apply, particularly withdrawal of life support. So I want to give you that sense that brain death is not accepted, right? When we looked at the physicians, they said 50% didn't think it was cardiac death equated with brain death. This might be a reflection of this legal pluralism in Islamic law. So moving on, the next slide. So when we think about what's the life not worth saving in the context of end-of-life care, we have to think about when can you remove life support. That life is not worth prolongating. And when they say this in the juridical councils, they talk about care is useless, meaning that you're going to harm the body, the individual. When the patient is terminal, there's no outcome benefit from that medical treatment. And when that person is brain dead, right? There's a physiological life, but it's not sufficient for life itself, or some optimum of life. So that's when you can withdraw. Between this is where we talk about end-of-life care. So you can move on to the next page. So I'm going to offer you, this is the third part and the final part of my talk, some theological rubric for what is that life worth saving. We talked about life worth not saving. We talked about when you must seek life medical care. Now what's the life potentially not worth saving? Or what is the life worth saving? So the purpose of life from various scriptural references is worship. I'm not going to go through the verses since I'm running out of time, but this idea of a life of utility is related to notions of discharging religious duties, particularly the idea of being able to worship and cognate God. If you look at the hadith, the next slide, this is made more explicit, and actually explicit in the context of medical care. So these are some of his statements. So he talks about an individual that none amongst you should make a request for death, for when any one of you dies, he ceases to do good deeds. So he disallowed his companions and his students to make a request for death. Then there was a companion who actually was suffering from a stomach malady, and he had asked about this as well. So he said, well, none of you should make a request for death because of the trouble in which he's involved, but if there is no other help to it, then say. And he taught him this prayer, which Sheikh Yasser also mentioned. "O God, keep me alive as long as there is goodness in life for me, and bring death to me when there is goodness and death for me. Right? So he was not allowed to ask for death except for bring death to me when there's no goodness and death in life for me. When there's goodness and death for me, sorry. So the life of value, according to the prophetic teachings, is an ability to effect good works. Right? Similar to the Quranic construct, that you should be able to discharge religious duties. So from that, we have this idea of quality of life. And I'll propose, this is my proposition here, that the quality of life marker is attached to this idea of discharging religious duties or ability to do so, and an ability to effect good works. But so that's the I'll get to that in a second, but given the fact that we want to preserve life, there are other things you need to know about from Islamic law. That preserving mere physiological life is not a worthy goal in and of itself. That treatments may be reprehensible because they violate two constructs. We talked about dignity here, karama and hurma. Right? So if you're going to do something to someone, this is with permission for a certain purpose. Right? But sometimes just intervention itself is seen as a negative act. So medical treatment was permissible, not obliged. Harming or doing something to someone, intervening upon someone, is an act that's by default problematic unless there's a reason to do so, right? So interventions need to have restorative potential so that life can fulfill its fundamental purpose. So you can move on to the last slide here, or almost the last slide. So in Islamic law, we have this, or Islamic theology, we have this construct called mukallaf, which is a morally liable individual. And it's defined as an individual who maintains sufficient cognitive capacity for assessing the benefit or harm of actions. And it's along a spectrum, right? So the marker of this is intellectual capacity, full intellectual capacity being aql, right? That exists from aql to discernment, the ability to discern between good and bad, and rushd, which is uprightness. So there's a spectrum, but it's tied to this idea of ability, cognition, and capacity to make decisions that can accord with harm and benefit in this life. And as I mentioned, Muslims are firstly accountable for religious duties. So the idea is that an individual has potential. A mukallaf potential is someone who has the capacity to discern between good and bad actions. And if they're Muslim, this would relate to primarily worship, right? Although it can extend, and it does extend Islamic law to other duties. For example, discharging financial transactions. So that's what I believe is a quality of life marker. So if in the summary, right, so seeking medical care, according to the Islamic Sunni tradition, is not always obligatory. It may become obligatory when there is curative potential for a certain treatment, and that's certainly known. Not posited, right, but certainly known. And we can potentially forestall death, and I use that with plus minus because, God controls when you die, so we can't really talk about forestalling death. But in any case, it can restore a life of quality, right, which is mukallaf potential. It can restore the capacity for an individual to cognate the harms and benefits of action, right, or have the potential to do so. That's why it covers children and others. Life support may be removed when it's not known to be effective in restoration of that capacity, or the life that is being preserved here is severely diminished, right? It has no capacity to affect afterlife. So this is the idea when the scholars allow you to withdraw life support from a brain individual or someone who has PVS. So the ethical plurality of Islam, right, sort of brings out this idea that whereas there is doubt or difference of opinion, one cannot claim a definitive moral obligation about an act. So you see this pluralism between the Sunni schools about when one is obliged to seek medical treatment, although there is a zone of consensus I pointed out to you. There's also a difference of opinion about brain death, but there are ways to think about them similarly, whether it's a dying state or a dead state when you can withdraw life support. So this is where I think we are at this point about Islamic bioethics and EndofLife Care. We can stop here. I think I'm out of time. Thank you.